have been. Indeed, analysis published this past weekend showed that places which imposed more serious restrictions tended to be faring somewhat better during this second wave, even though the situation here is critical. The new cases we are seeing today are likely the result of transmission before Christmas. Even when we all stay home as much as possible, it takes weeks to see the results of our collective sacrifice. That's why it's so important that we continue to stay at home as much as possible beyond the holidays and into January. This will make a difference, this will save lives, and this will protect our healthcare system from being overwhelmed. I spoke to a number of people involved with the healthcare system over the weekend, and they described their COVID-19 vaccine in hospital efforts as they expand early in this new year. While the vast majority of the vaccine rollout is beyond the city government's control, I will be working with the federal and provincial officials, together with Chief Pegg and everybody, to make sure that it happens as quickly as possible. Just today, Premier Ford confirmed it will be full steam ahead, as he put it, on vaccinations, and they will be ramping up these efforts over the coming weeks, and we look forward to falling in behind them to provide the support that the city has asked to provide to this provincial effort. While it is good news that COVID-19 vaccines are here and being administered, lockdown, we know there are more people of the benefits available to them and the job protections that are in place for them. Toronto Public Health is also recommending that employees are informed by their employers of income replacement and workplace-related benefits that they're entitled to if they have to isolate due to COVID-19 symptoms, when they're being tested for COVID-19, or if they're in close contact with someone who has tested positive for COVID-19. This is another example of action the city is taking to protect people from COVID-19 and to do everything we can to stop COVID-19 from attacking Toronto residents. And we won't stop taking action to help save lives and to protect the health of our city and its residents. Now I will ask Dr. de Villa to update us for today and to provide us with further detail on the additional workplace measures being implemented by Toronto Public Health.
Thank you, Mayor Tory, and good afternoon. 24 new cases of COVID-19. 1,061 new cases of COVID-19 breaks across 11 categories, including workplace settings like grocery stores, pharmacies, food processing sites, offices, warehousing, shipping and distribution, construction, and manufacturing facilities. Additionally, Toronto Public Health is implementing a system to share specific information about workplace outbreaks without compromising individual privacy. That information will be posted today and will be updated weekly on Thursdays. The criteria for disclosure include sustained transmission of COVID-19 in a workplace, where a significant proportion of staff have been involved in the outbreak, where there is significant duration of an outbreak, risk of privacy concerns are mitigated. Contact person to work with Toronto Public Health. Employers are required to minimize instances where more than one individual is traveling in a vehicle associated with the work of that business. They must implement rigorous and frequent cleaning in all high-touch areas and areas accessible to the public, and ensure regular functional assessments of heating, ventilation, and air conditioning systems. Employers will also be required to ensure that physical distancing of employees by at least 2 meters takes place throughout the workplace where reasonably possible. As mentioned, employers are also required to ensure all employees are aware of any which they may be entitled in the event COVID-19 usual. These are a resource upon which we can draw in the distance will produce results. The ability to create it lies within all our hands at this critical time. I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa, and good afternoon. Today marks the 300th consecutive day of Emergency Operations Centre activation in response to COVID-19 in Toronto. Our teams continue to work in close collaboration with the city's senior leadership team and each division, agency, and corporation in response to the global COVID-19 pandemic. The enforcement of public health-related regulations has been a top priority for the City of Toronto since the outset of COVID-19. Working diligently to enforce the regulations 138 snowboard hills for various activities, including tobogganing. Our municipal licensing and standards team, working in collaboration with Parks, Forestry and Recreation and Toronto Police, continue to work together to support safe outdoor activities while protecting public safety. There is a full list of safe tobogganing hills on toronto.ca. We continue to be hard at work, supporting the continuing implementation of the COVID-19 mass immunization campaign. Our immunization task force has been fully engaged on a daily basis throughout the holidays, and we continue to work every day to ensure that we are ready to launch mass immunization clinics as soon as vaccine is made available to us by the Province of Ontario. I'm also very pleased that City long-term care staff, in collaboration with Toronto Public Health and University Health Network partners, are making excellent progress in vaccinating the residents, staff, and caregivers in our city-run long-term care homes. Our immunization task force is working to support this important and life-saving work. And the Province of Ontario's vaccine distribution around the clock as we prepare for the provision of additional
traditional communicable disease. So let me tell you two reasons why reporting transparency by informing the and secondly, workplace safety. The data informs enhanced measures needed to keep workers safe. And by drawing attention to unsafe settings, we can hold employers and also governments accountable. And so in a pandemic, information is power. Information can also provoke change. When Toronto Public Health started collecting and sharing data on cases by neighborhood, it led to the establishment of pop-up mobile testing sites. When Toronto Public Health started collecting and sharing data on cases by housing status, it led in part to the creation of Canada's first voluntary self-isolation centre. And when journalists began reporting on cases amongst migrant farm workers, it led to action. And so our intention here is not only to inform, but to spur action to protect workers. In many ways, the story of this pandemic is also a story of work. To put it simply, if you were fortunate enough to work from home over the past year, you were less likely to get COVID. It's the essential frontline workers, the heroes we talk about, stocking our shelves, packing our online orders, delivering our packages, and taking care of our most risk. And so until we collectively, and to our essential frontline workers, to the men and women going to work each day so that others can stay safely at home, we will continue to do everything, absolutely everything in our power to protect you. With that, I'll turn it over to Brad to open it up for questions.
Thank you, Councillor. Just before we go to questions, just a reminder to please, reporters, unmute yourselves before asking your questions so we can hear you. We also have a number of staff on the line who can answer any detailed questions you may have. First up is Francine Copen from the Toronto Star. Go ahead, Francine.
Oh, hi. My question is for Dr. de Villa. Dr. de Villa, in light of your comments about distance being our greatest resource when it comes to COVID-19, I'm wondering how you feel about the decision to reopen elementary schools beginning on January 11th and high schools on January 25th. Is this a decision that should be revisited?
So, Francine, I think, throughout the course of the entire pandemic, it has certainly been my counsel and advice that we should constantly be assessing and reassessing our circumstances and adjusting our actions depending on what we actually see on the ground. When it comes to schools, as you know, this is a decision that does rest in large part with our provincial counterparts. But I think in the main, what I would say is that with schools, we have this very interesting balance that needs to be struck, and we have to observe that which has happened. What the experience has been, by and large, is that there is not a great deal of transmission that happens in school. What we are seeing is that as levels of COVID-19 activity in the community are increased, it is also reflected in our school system. So that's in the main. That's not to say that it never happens, that there isn't transmission, but by and large, is that the experience is very similar. What we're seeing within our school communities is more a reflection of activity throughout the entire community. Reasonable expectation for us to have assessing, constantly observing, and adjusting actions as need be.
A follow-up question. You mentioned that there's not a great deal of transmission in schools. Is it that there's not a great deal of transmission in schools, or we're not doing the kind of, asymptomatic testing that would uncover the fact that, in fact, transmission is happening? It's just happening between people who are asymptomatic.
So, as more testing methods become available, there's certainly been more efforts put out in schools with respect to asymptomatic testing. But in fact, the investigations that have been done over the course of the fall here in Toronto, and my understanding is that this was the experience in jurisdictions all around the province, maybe not in every place, but in a number of jurisdictions around the province, when investigations were undertaken in respect of cases that were found in school, that transmission was not happening in the majority of cases in the school itself, and rather what we were seeing in the majority of cases was cases that were reflective of infection that was acquired outside of the school and that reflected the level of community spread rather than something happening in the school per se.
From CTV News. Go ahead, Austin.
The Canadian Civil Liberties Association is calling for a police budget. They want that money to go to mental health. Mayor, Councillor Cressy, do you see this defunding?
First of all, I get reports and submissions all the time to achieve, which is to find better ways in which we with crises in their lives due to mental health issues, health professionals than by police. So what we're doing is very simple, but doing it properly and carefully. We are looking at every task carried out by the police. We are looking for areas in which those same tasks might be better carried out by other kinds of professionals, including mental health professionals, for example. And then, and only then, once we've identified a better way to do this, will we reduce the police budget. And so I think that's the thoughtful, practical, careful way to go about this. We're doing it with as much speed as we can, but carefully. And that is the approach we will continue to take.
Well, and thank you, Austin, for the question. I will admit I haven't had a chance to read or review the report that you referenced, but I think the objective of our city and our community remains the same, which is how do we seek to support the residents in our city, especially those who are experiencing homelessness, those who are in a mental health crisis, in a manner that responds to their needs. And I think that's part of the important discourse that is taking place across North America and here in our city right now around reform and budgets, and that's a discourse that's going to carry forward. But I haven't had a chance to read the report, I'm afraid.
Follow-up, Mayor, do you see something like this happening in time for the next police budget?
I think we will bring about the task of reassigning tasks to people better suited perhaps to do some of this work, say with people with mental illness issues, away from the police as quickly as we can. But we've got to do it properly and compassionately and carefully. There's no point in us doing what some seem to advocate, which is just cutting money out of the police budget, when sometimes now they're the only people who are available to respond to some of these problems. So we will do this work as quickly as we can, and we will do it carefully, and we will do it with a view to finding the best way possible to support people who are in crisis or support people who need help. And if the police aren't the best way to do it, pursuant to this commitment to reform, then we'll find better ways to do it, and then we will reduce the police budget accordingly. But we can't do it the way that some people suggest, by waving a magic wand and assuming we can do it overnight. It's just not practical, and I'm not going to make promises that I can't keep, because my overall responsibility as mayor is to keep people safe, to keep people secure, and to make sure that we look after them as best we can. And we're finding better ways to do it as we speak.
Thank you. We'll go next to Matt Bingley from Global News. Matt, go ahead.
Hi, good afternoon and Happy New Year. Dr. de Villa, I'm just wondering why you have decided to choose now as when with the province's lockdown measures restricted there, would it not have made a little bit more we see between large big box stores selling non-essential?
Couple of things. Clearly the COVID response to effect for public health. So there are a number. We've tried to ensure that we're focusing on those. So we do have an opportunity. The opportunity presented itself. We do know that there are a number of workplaces that, of course, need to continue to operate, even as we are in this phase of the pandemic. And so it made sense to us that we should seek to control risk and to, do the best we can to support the safe operations of these businesses now. And of course, as we move throughout the pandemic, this is not something that will just be of interest or of importance at this point in time. But certainly, as vaccines are deployed, as we start to move hopefully beyond this wave and start to see a brighter component of 2021, these will continue to be important elements for the safe operations and the resumption of operations in as safe a manner as is possible for all of us in workplaces, essential businesses, and those that are perhaps not operating now, but hopefully at some point will be operating in the future.
And to follow up, the number of charges laid for gatherings, I think it's fair to say that in a couple weeks' time we'll be seeing the extent to which cases rise because of that. I'm wondering beyond that, because we're into winter, because there isn't as much of a temptation to gather for the holidays, or quite simply because there's really nothing to do. Do you foresee that after we get through this next wave of infections from the holidays that things could perhaps peter off?
Well, certainly, I guess I can start with that, Matt. That's certainly our hope. I mean, clearly, all the way through the pandemic, our goal has been to mitigate the impact of COVID-19 on our community. And with that in mind, reducing the case count and reducing the spread of the virus has been always top of mind for us. So we are certainly hopeful that that will happen. And I would further suggest that as we have tried to make clear over the many weeks and months of the pandemic, and particularly over the course of this past fall, what it takes to actually reduce that spread significantly rests in our hands. To the extent that we are able to limit our interactions, to the extent that we're able to maintain our distance, to the extent that we are able to stay apart from those with whom we don't live, this is where we actually can really be incredibly powerful. And that will only be augmented as vaccines become increasingly available to the population. But it's still important.
Okay, thank you. We'll go next to Dave Woodward from Global News Radio. Dave, go ahead.
Thank you. Dr. de Villa, kind of piggybacking on Matt's question, many of these requirements, like keeping 6 feet apart, some rigorous and frequent cleaning practices, they were already well known to help slow the spread of COVID. So why haven't they been implemented until now? And how are these new measures going to be enforced if businesses don't comply?
So you're right. Many of these elements are good, solid infection prevention and control practice in the time of a pandemic. And these were certainly messages that were out there. So what has been put forth in writing and what will be shared with businesses and employers throughout the city, some of the elements are new and others are reiterations of good, solid guidance and advice now put in the context of the existing provincial legislation that exists right now. So, but I think that at the end of the day, what this is about is seeking to make workplaces and businesses that need to rightfully operate in the midst of a pandemic. Many of these businesses provide those essential services and supplies. You heard Councillor Cressy talk about workers that are actually doing things, providing services, providing goods and products so that we can go about our daily lives. So these are important businesses that need to continue to operate. And the question is, how do we make sure that we've got appropriate public health measures, that we're managing public health risk as best as possible, while at the same time ensuring that businesses are still able to operate as safely as possible in the context of a pandemic? And that's really what this, these instructions, these requirements are all about at the end of the day.
And I guess my follow-up would be for, I don't know, Mayor Tory possibly. How are these measures going to be enforced if businesses don't comply?
Well, I think in many cases we've asked for the province to be stepping up the level of inspections in businesses generally, and I think that will allow an opportunity for somebody to be inside those businesses looking at what's going on. And similarly, we have people that can do that upon a receipt of information that would cause us to want to do that. But let's not also forget the fact that a lot of this has to do with information those employers have to provide now to us, in which case, depending on what's provided, that can lead to other visits and examinations of what's going on in those places of employment. But maybe Dr. de Villa wants to add to that.
Yeah, so I think, the mayor has covered it off well. Certainly we do take reports of situations that give rise to concern, whether it's members of the public or people within the context of specific businesses and workplaces. But, we have found in the main that people do respond and provide us with information, and they are following advice. And so we are entrusting our business partners and our employers and workplaces throughout the city to provide information as they are being instructed to under the current provincial regulation and with these new requirements in place. We will, of course, accept information from people if there are concerns around specific situations. We investigate those and we take action as is necessary. But it does fundamentally come down to each and every one of us in terms of trying to get that distance, trying to, do all those self-protection measures that we know work in terms of controlling COVID-19 spread. And yes, they are just as relevant whether you are, out and about, in a, retail setting doing something for your own purposes, or whether you're within a workplace or an essential business. Those self-protection measures work against COVID-19. It does fundamentally come down to distance and all those self-protection measures you've heard us talk about so often.
And if I could just add, the letter of instruction Dr. de Villa has issued very clearly requires all employers to take these additional measures. And it accounts for our ongoing collaboration and request with the Ministry of Labour to continue with proactive and step-up inspections. But none of this precludes our medical officer of health from taking specific and direct interventions for workplaces that aren't adhering, as our medical officer of health has done throughout this pandemic. So while these new measures are a requirement for all employers, and it does don't comply, our medical officer of health can and has in the workplace.
Thank you. Go ahead.
Some of the new rules, or is it going to be taken on a case?
It is clear that the requirement, the Health Protection and Promotion Act and a Section 20, and it is actually specifically designated for the control of communicable diseases within the city. So that's the kind of action that we can take. But of course, as Councillor Cressley rightfully pointed out, we are expecting that businesses will comply of their own accord because, in fact, it just makes good sense for business to have healthy employees and healthy workers. And these kinds of activities, the actions and measures and the requirements that we're putting out there today are about creating the conditions that allow for the appropriate mitigation of public health risk and at the same time the safe operation of businesses, given that we are in the midst of a pandemic.
Great, thanks. And I just have one more question about the spike today. I know the mayor said at the beginning that we can't really say yet if it's directly related to Christmas, but is there a sense that it could be related to holiday gatherings kind of in the days before, or kind of any link to the holidays, really, with the numbers today?
So, with respect to the numbers today, the cases that we're seeing today were the result of infections that were acquired before the holidays. What might have happened over the course of the holidays will emerge over the course of the next couple of weeks. People present for testing and subsequent diagnosis. Get that infection. So we should expect to see the course of the holidays, in the next days and weeks. However, it's still not too late to control the spread of COVID-19 in our city. The more we can actually take advantage of the fact do their work as they become available for us. Even now, to continue to maintain that distance.
Thank you. We'll go next to Mark McAllister from City News. Mark, go ahead.
Thank you. Happy New Year to everyone. Dr. de Villa, if we could start perhaps by maybe quantifying workplace outbreaks for us. Throughout this, it's been a vague number, workplace among other areas and places. Is this the reason why we're now having to see more reporting on the website and publicly because we didn't really know beforehand, or simply because you want more people to know?
I think, as you have seen throughout the course of the entire pandemic, we have always adopted new actions, including data reporting, in response to that which we see, in our community, and in order to better inform our response and to inform the behaviors of the residents of Toronto in protecting themselves against COVID-19. And so we are at a point in time, we are recognizing that there continue to be workplaces, essential workplaces and businesses that are operating. They are a particular place right now at this point in the pandemic where there continues to be some degree of interaction outside of the home. And they will continue to operate even as we produce, or as we go beyond this stage of the pandemic. So, and as we progress through the pandemic. So it seemed an appropriate thing to do in order to best manage risk as it exists right now in our community. It will continue to have value as we pandemic. So that's really our thing. Us find new ways to respond. Looking for new and better ways to help.
Word the question a little bit differently. How, when the question about reporting on workplaces specific concerns you didn't necessarily want to divulge some of that specific information. So how bad has the problem in those specific areas been?
You know, Mark, it's an interesting question that you ask. I don't know that there's a very simple or straightforward answer. There are some areas and there are some workplaces that have had more challenging outbreaks. And there have been other workplaces that have gone completely unscathed, if you will, in terms of outbreak. I think that, as I mentioned, what we are trying to do here and what we have always tried to do throughout the course of the pandemic is to provide information when it makes sense, when we have a specific route that we can follow that clearly has benefit in terms of enhancing our response to COVID-19 and its spread in the city. So that's what we're doing here, and you will continue to see us constantly developing, whether it's data reporting or other courses of action to try to reduce the spread of COVID-19. We will continue to explore new methods and implement those that actually make sense for our circumstances.
Thank you. We'll go next to Angelina Kane from CBC News. Go ahead, Angelina.
Hi there. The website isn't updated yet, so I'm just wondering, can you give us a sense of what will look different for the public other than the 11 categories? Like what kind of information they'll be able to glean from the new website when it's updated?
So as the website gets updated, there will be the categories of workplaces, and we will have information regarding active outbreaks and the cumulative number of outbreaks within each of those categories of workplaces. So you will see that component on the website, and as well, there will be specific workplaces for which further detail will be provided, so that where those particular workplaces have met the criteria that I described earlier this afternoon in my remarks. Specific workplaces where there has been sustained transmission, where there's been a significant proportion of workers that have been impacted as part of the COVID-19 outbreak within that workplace, where there's been an outbreak of significant duration, and for those workplaces where there is not as much of a privacy risk given the size of that workplace. So those specific workplaces will be identified in our website on a week-by-week basis as we update the information on the website.
Thank you. Since it's not updated yet today, do you have information for how many workplace outbreaks there are currently in Toronto, and then the cumulative total as well?
So I think, if I remember correctly, and you'll have to forgive me here, so I don't have the cumulative total right now. I do believe in terms of active outbreaks, the last I heard was 16.
Okay, thank you. We'll go next to Mike Walker from CTV News. Mike, go ahead.
I apologize, sorry. Thank you for taking my question, and Happy New Year. Just kind of piggybacking on what some of my colleagues asked earlier, why now? Are we seeing still significant outbreaks in workplaces? Where do workplaces lie in terms of where we are seeing transmission?
So I guess what we've done, as I've tried to explain, is that when we have provided new actions or taken new actions in the pandemic, it has always been in response to that which we are seeing in our community. And given that we are at this point in the pandemic, and given that we are within a lockdown under the provincial framework, there are which we are seeing interaction between individuals. COVID-19 spread and transmission. Time now, it does take some time to issues to try and provide on. So we've worked hard on making sure that we're providing information officials and the public in terms of themselves and to limit their interaction with areas of public health risk. That's always been our goal in terms of taking on new actions, which includes data reporting. So at this point in time, recognizing that workplaces, essential workplaces, need to conduct their business. They're important in terms of providing the goods and services that all of us use on a daily basis. But because they're out there, and many of them do require in-person sorts of work, it does continue to be a source of transmission for COVID-19, as is any activity that happens or that involves you leaving your home and interacting with other people. So we feel that it's important at this time to provide information and to make sure that businesses and workplaces are also being instructed to take the necessary actions to reduce the risk of COVID-19. As I've indicated, that's been our goal all the way through. What actions can we take? What measures can we take that actually reduce the spread of COVID-19 in our city? And this is one of the things that can be done to enhance the safe operation of businesses and essential workplaces at this point.
And if I could just add, Toronto Public Health, since the beginning of this pandemic, has been amongst the first in the country when it comes to data and reporting, whether that was on cases by neighborhood in our city, by income, by race, by housing status. And it's always been with the objective that collecting data, that's not the point. Using the data to inform Toronto Public Health's response to protect Torontonians, that's the point. And so to the question of why now, I would say from a Board of Health perspective, it's about our commitment to constantly scaling up and improving our response every day, every week, every month. And I think that's what Dr. de Villa and her team have done since the beginning, and we will continue to do.
And just as a quick follow-up, just seeking a little more clarity on terms of enforcement. I know the expectation is that businesses will comply, but who's going to be enforcing this? How will we be following up, making sure businesses are following through on these measures?
Well, certainly as Toronto Public Health, as we become aware of circumstances within workplaces and workplace outbreaks, we are following them up. Now that we have this requirement of employers, we expect that we should hear from employers and businesses and workplaces when they've got 2 or more cases of COVID-19 so that we can help them address whatever risk might exist within their workplace. But as well, we have received reports from the public all throughout the course of the pandemic, and we follow up on all of those in order to do the best we can to mitigate risk. And finally, as you've heard both myself and Councillor Cressy speak to, should there be specific circumstances where we see that there is a communicable disease risk, and in this instance, we're talking about COVID-19 risk within a workplace, and if businesses or employers are not taking appropriate action to reduce the risk of transmission of virus, then we have the option of using our existing powers as public health under the Health Protection and Promotion Act. But we do sincerely hope that employers and businesses really appreciate that the safe operation of their business, the safety and health of their workers, is of course important to a safe and healthy business, and it's part and parcel of their responsibility. I think the only other point that I would make is that over the course of the pandemic, I will say this, that the team at Toronto Public Health has actually increasingly worked in tandem with our colleagues at the Ministry of Labour and ensured that, when there are circumstances that clearly do warrant their intervention and that have to do with those elements that are under their purview and under their jurisdiction, we're making sure that they're aware of it. We're advising them of circumstances if there are concerns so that they can step up their inspections and do what they need to do from their perspective as the Ministry of Labour, Training and Skills Development.
Okay, thank you. We'll go next to Sarah Mostahedzadeh, and I apologize if I mispronounce your name, Sarah, from the Toronto Star. Go ahead, please.
Thank you. This question is really for all three of you. You talked about working in tandem with the Ministry of Labour. We know that as of mid-December, the Ministry of Labour had only issued one fine to an employer for COVID-related workplace safety violations. Are you satisfied with the
I think that this is something that is very important to a number of people who would just not go and get tested and in fact go to work sick and can cause a workplace outbreak inadvertently because they're afraid of losing their paycheck. And I think it's time that we had action, past time, that we had action on that.
And finally, Sarah, on my part, I think it's fair to say that protecting the health of frontline essential workers requires more from all levels of government. And I think we've spoken to a number of those pieces here today, whether that's the provision of sick leave, as the Mayor just indicated, or the recently announced efforts by the Ministry of Labour to strengthen and enhance inspections. That's a welcome move, and we'd like to see that. But all levels.
Their workforce is impacted, or where for an outbreak, which demonstrates, again, that ongoing and sustained transmission and therefore increased risk associated with that outbreak. The issue with those is that if you're going to get into very specific disclosure, if the workplace is small enough, so for example, only has 3 or 4 employees, as would be the case in a mom and pop shop, as you described, Lucas, by virtue of the fact that there's an outbreak, I am by definition, identifying people and therefore disclosing personal health information. So in those kinds of circumstances, we wouldn't be able to disclose because we would be by definition violating the personal health information or the privacy of those individuals and their personal health information.
And so maybe just a quick follow-up on is there like a specific number of employees?
To provide the best information to the public and to inform our own actions and response as we seek to control COVID-19.
Thank you. Final question is to Miriam de Villa from the CBC. Miriam, go ahead, please.
Hello, can you guys hear me?
We can, yes. Go ahead, please.
Thank you, Brad. Hi, everyone. Happy New Year as well. My question is in French for Mayor Tory. Bonjour. C'est pour parler de la réduction du budget de la police de Toronto. Allez-vous considérer une réduction du budget allant jusqu'à 340 millions de dollars?
Ce n'est pas une tâche simple comme suggéré. Nous examinons maintenant actuellement les fonctions de la police et examiner les possibilités de remplacer la police et peut-être employer les professionnels comme les professionnels de santé mentale pour répondre aux situations dans la ville de Toronto. Et ensuite, et alors seulement après identifier les opportunités de remplacer la police, maintenant réduire le budget de la police pour tenir compte de ce qu'elle ne fait plus. Mais seulement après identifier les opportunités de remplacer la police.
And as a follow-up, est-ce que ces initiatives seraient communautaires seulement ou ça serait des partenariats avec la police de Toronto?
Je ne comprends pas la question. Répétez, s'il vous plaît.
Perhaps I'll say in English. Would these be community-based initiatives only, or would there be in partnership with Toronto Police Service?
Les opportunités que nous allons identifier maintenant, ce sont les opportunités de changer le méthode pour la police, mais nous allons identifier les opportunités avec les organisations communautaires, comme les organisations de la santé mentale et les autres. Et ce sont les opportunités pour la police, mais si nous allons identifier les autres opportunités,